Many patients don't trust their doctors and tend to ask for second or third opinions. Would the app that you talked about be successful, successful in getting people not to go for second or third opinions? So if I start at your end, so this cultural change, I think, is the kind of part of the innovation story from the user end as well as the delivery side. Will these apps, will people trust them?
Yeah, I think it depends on how it's implemented, right? So I think what the regulator's interested is to make sure that if somebody goes for a second or third opinion, they've been referred, right? That there's, or at least that there's a good medical reason for it. Many people visit multiple doctors because they don't have confidence, or they're just worried, right? Maybe they shouldn't be. So telemedicine is one good intermediary here, which might help assuage some of that concern. So they could call a doctor. It doesn't cost the same as a physical consultation, but maybe it could just assuage some of their fears. The doctor can give them the referral if they need one. So it's about looking at other ways to structure the process to save costs, but also to maybe build the confidence of the patient in the healthcare quality itself.
So, Dr. Osama, do you think that one of the added benefits of e-health and going big data online will be it'll increase the trust in your first doctor's opinion and perhaps improve efficiency?
Well, I think this kind of trend will never stop. Even for me, every patient will need to get better or a second opinion. This is very natural. I think, as I told you, e-health can support this process. So it's about making much easier, much faster, much effective. Also by having what we call the 360-degree view of the patient data as a whole, it will give even the doctor a better can I say decision about whatever diagnosis that's required. So, because I'm sure that the doctor sees whatever data around me, he will make a better decision. So this will support some sort of a trust.
Okay, and finally to you, Prashant, the same question really. How will these innovative concepts, how will they change that, the culture, the behavior of consumers and healthcare providers?
Exactly, it's very difficult to come out of this culture. As a human being, we are very much bothered about nothing other than the health of the particular individual. And then with the new technology coming in, like you can Google and find out any information today. We have, as I mentioned, we have 1,400 doctors. One of the biggest challenge that the doctor is facing when I meet them is that Google is their biggest competitor for the doctor, because the information with which a patient is entering into, maybe the medical knowledge is not sufficient for him. In maybe a right information, maybe a wrong information that is available in the internet is really bombarding that with the patient, and he wants to test everywhere. So it's very difficult. But what my view is that the unified medical records, whereby the patient goes in, and that will definitely able to identify the doctor's ability to identify. For example, a regulator or insurance company will later identify why the patient moved from one doctor to other doctor. So now we are talking about the jada of identifying and benchmarking the hospital. Maybe a point will come whereby we start benchmarking the doctors of the same profession, whereby is it because of the general inquisitive nature of the person who moves from one doctor chamber to other, or is the doctor was unable to really identify and sort out his problem. And also, exactly, I will again echo the same wordings of Mr. Osama, that the unified records will also help the medical interaction happening in the body of the individual, because he has got multiple diseases. Today we have too many streams of super specialisms, something like even dentistry, you walk in, you will have 18 types of specialisms happening in dentistry. So patient is completely sometimes confused, which is the specialism I need to walk in. And then that specialist is really focusing on that particular knowledge that he possesses. So maybe a general holistic view will come from unified. A primary care family physician who handholds may emerge out of it, which will definitely reduce the cost of provision of healthcare and make it more available for the people.
Excellent. Well, that's a perfect note to end on.